Now to a health alert. There's an alarming rise in pertussis cases in Minnesota. That's the whooping cough. In 2023, there were just 61 cases reported to the Department of Health. But now take a look at this. More than 2,300 cases from the beginning of the year through December 5th. A 3,000% increase. Danny Spiewak spoke with the doctor today to find out what's behind the spike. Danny?
Well, Lauren, during COVID, whooping cough cases bottomed out because more people were socially isolating. Now the disease is making a major comeback, with the Minnesota Department of Health reporting the largest spike so far this year in 13 years.
As a bacterial infection of the lungs, whooping cough is highly contagious.
Especially in younger kids, under 1-year-old, under 6-month-olds, they get hit the hardest with pertussis.
Dr. Liz Plotchek treats those patients as a pediatrician with Children's Minnesota.
It may seem like a cold at first, but we see some really serious complications and prolonged cough, including periods of apnea or stopping breathing. That's what really scares us about the youngest kids in pertussis.
Right now, whooping cough cases are skyrocketing in Minnesota, rising from 61 last year to more than 2,000 so far this year, according to MDH.
So we're seeing tons of whooping cough.
The illness impacts everyone, but most cases are circulating among kids, with 14 as the median age.
We see some seasonality. Every few years we see an increase in the number. Also, vaccine rates have decreased a little bit.
That's part of a larger trend across the country after COVID fueled more vaccine skepticism. According to the CDC, rates of routine vaccinations among kindergartners have dipped from 95% to 93% since 2020. A slight but significant drop that has national experts worried.
Maintaining our vaccine rates, whether it's measles, whether it's pertussis, whether it's influenza, whether it's COVID, will make our society and our most vulnerable healthy.
For whooping cough, the CDC recommends vaccines throughout infancy and before kindergarten. Then another shot is offered at the age of 11 or 12 to prevent the vaccine from waning.
As a pediatrician, we know how well these vaccines work, and we know how much kids benefit from their protection.
The CDC also recommends the whooping cough vaccine for pregnant women in their last trimester. That will help pass protection to babies. Back to you.